Welcome to Verified RX, your prescription for success, brought to you by the Vizient Center for Pharmacy Practice Excellence.
Pharmacy and therapeutics committees have long served as the cornerstone of medication governance and are required for hospital accreditation. Historically, they operated at the individual hospital level, but now these committees are evolving into enterprise-wide governance programs as health systems expand and care becomes more costly and complex. The increasing number of hospital and health systems mergers is further accelerating the need for system-level oversight. In addition, we're in the age of the rise of high-impact and novel therapeutics, and this has introduced unprecedented clinical and financial complexity. There is a need for best practice considerations to guide health system enterprise P&T committees. To address this, the Vizient Center for Pharmacy Practice Excellence convened an expert panel comprised of individuals with diverse leadership roles and significant experience across pharmacy departments and enterprise P&T committees. Panelists participated in 4 focused work groups: evidence evaluation, structure, finance, and revenue cycle integrity and implementation. They deliberated key challenges and opportunities to develop best practice considerations. This expert panel concluded that health system enterprise P&T committees are uniquely positioned to balance clinical value with financial stewardship and minimize practice variation. These best practices represent a dynamic framework designed to evolve alongside emerging therapies, evolving technologies, and the ongoing transformation of health systems. With us today are 2 members of the panel. We have Conor Hanrahan, AVP, Enterprise Pharmacy Services, Medication Outcomes and Stewardship with Intermountain Health. Also joining us today is Prabashni Reddy. At the time of the panel, Prabashni was the Executive Director of Medication Use and Policy at Mass General Brigham. Conor, Prabashni, welcome to the program. Prabashni, why did you want to join the panel?
I'm excited to see the bringing together of many minds from across the country to discuss this topic. At my role at Mass General Brigham, it set up an enterprise P&T committee in 2015. At the time, I was not able to identify some sort of published guideline, detailed recommendations. What I had to do was piece this together from a couple of articles, speaking to some folks across the country. And this was a wonderful idea to be able to meet so many folks across the country who've done this work and to be able to pick their brain and share and learn from others as well.
Healthcare has changed drastically in the last decade, and we've seen a lot of mergers and consolidations. We've become just so integrated in how we do everything in pharmacy and medications. I was really looking to better understand, how do we do medication management optimization work and pharmacy and therapeutics committee work at an enterprise level and scale, because there was really a dearth of best practices and information on that. The opportunity to come together and dialogue about something where there's not a lot of detail and context was super interesting, so that we could better our own organizations and learn.
Sounds like you were really excited to be on the panel. Looking back, what were some of the benefits of being on the panel? What did you learn just from your interactions during the kickoff and the work group meetings?
I was struck by how similar yet different all the organizations were, and got some comfort knowing that we're all struggling with the same issues and challenges in healthcare and doing this work, and that no one really has all the answers. There were certainly some best practices that we came up with, solid approaches that we think benefiting not only the organization, but our patients at the end of the day, which is why we do this work. But comforting to know that we're all marching in the same direction and are all kind of struggling with these same things.
There were 4 work groups around this, but even within the 2 work groups that I spent time, what was helpful to hear is that some folks were ahead in some areas, others were in other areas. There was no one organization that had all the answers. And that was what was really helpful is we're going to really learn from each other. We're going to be able to pull the best practices from across the country. And it was very validating because when you do this work, you're often in sort of isolation within your own organization. And to be able to pull in folks from across the country, everybody's bringing something a little different to the table, and to share that in-depth knowledge and in-depth experience of how things have gone, I felt incredibly helpful, validating, because we struggle with this. There's no recipe or cookbook out there for one to follow. And so you get some information, you make educated guesses on the best way to proceed and sort of hope for the best. Being able to confirm this with some peers across the country is a wonderful experience.
Totally. And now it's exciting that we will have this resource. We're all super grateful that Vizient pulled together this panel because this is really needed. I think it's going to be really exciting when it's released and useful to members.
Yes, I absolutely agree. You've talked about heterogeneity and how we're pulling different people from all different organizations to make educated guesses. Let's talk about some surprises. What were some of the things that were brought to the table by all these panelists that you found really intriguing?
The group generally agreed that we need an evidence evaluation framework. It was very clear consensus. What was surprising was that no one seemed to have found one that was published in the literature that met everyone's needs. Interestingly, my team had looked at this a couple of years ago. We actually specifically focused on a couple of the oncology frameworks. We had, I believe it was one of our residents and staff pharmacists working together to put a bit of an overview of this together. And we presented to our oncology subcommittee. And with the end of that discussion, we agreed that it just didn't quite fit the needs of the P&T committee. A couple of other folks around the table came to the same conclusion when they evaluated these frameworks independently. Then what was even more interesting is that a couple of us had actually developed some of these homegrown frameworks. Each of these look quite different. I was surprised. I had assumed many folks across the country had somehow figured a way how to use these existing frameworks, but what we realized there isn't one in place that works for P&T committees. Some of the challenges we found with the frameworks was that the economic component of it just didn't meet our needs. We're not a country that uses quality adjusted life years gains to make decisions. An element that was often missing was really understanding what the standard of care is. And if something's lacking, it's very difficult to deny access to a therapy if you don't have an alternative for the patient. So the evidence framework thing for me was surprising, and this need to develop a homegrown system. So that was one area for me that stood out.
I love that. We can come up with these best practices, but we have to be organization specific in a lot of cases to make sure we meet the unique needs of our patients and our market demographic. I was really surprised by a few things. One of the big ones was just sort of the dialogue around enterprise versus local authority when you're in a health system. Going through our own struggles in my organization to implement shared services and an enterprise approach, I really thought more organizations would have been more of a proponent for still some local control or regional control over things. And I was really pleasantly surprised that we're all very similar in the sense of the benefit of doing this at an enterprise level in a large organization is to actually have enterprise oversight and a fair bit of control for the organization to make sure that we do things consistently, that patients are getting the right level of care no matter where they are and those things. The focus is certainly the local team is needed, but really around implementation and boots on the ground work and sort of that balance and interplay. I really loved that dialogue that we were able to have and what's in the final report. And then the other thing, which sounds a little silly, but was very surprising to me, was the role of medication safety. Through my residency and fellowship training, what I've been exposed to, the medication safety team was always a part of the Pharmacy and Therapeutics Committee structure. And it was really eye-opening to hear that that's not the case in many other organizations. I can see how that makes total sense because not every medication event is directly tied to formulary or policy work or some of the things that P&T has a lot of oversight of. So I really enjoyed learning from my other colleagues on that. Of course, we all reiterated there needs to be some connection with that regardless, but having that solid line was maybe not necessary in every case.
What we heard in the group meeting was there are a number of organizations that have enterprise safety and quality groups. And that's where medication safety would dock into. You definitely needed that connection with P&T. And that's building on that concept of the heterogeneity and that there's no one size fits all. Because some organizations may have that enterprise quality or safety function and others may not. what the group landed with is safety is part of the purview of P&T, but whether it sits formally within P&T or it's some other enterprise group was fine. And you really have to work within the structure that exists within your own organization.
Prabashni, the other thing I was curious about your experience, because I didn't sit on this group, was around the use of AI. It sounds like maybe it's not as integrated as it could be at this point.
That's such a good point. There were a couple of us on the group who had started to use some AI to generate content. So you can just think about the various ways one can use AI. One can use it for potentially some project management components. You could build sort of queries. But we really had heard maybe from 2 or 3 folks who had just started experimenting with it. My takeaway from it is very early days. Some of the key pieces of information that did come out, the group thought there was potential, but they always felt at the end of the day, you do need that human oversight of this. It does have to be somebody with a drug information background or specialization. It's not something one can hand off to sort of a non-clinical, non-trained person. And maybe I think the term for AI in this case is augmentation as opposed to replacement. How can it help us do our job a little quicker? Maybe it could be even more help us with some sort of accuracy issues and quality control. So there's a role for it. The key message at the end of the day was it's very early days for P&T committees yet.
One thing that surprised some of the panelists was this philosophy of guiding criteria and principles versus exact thresholds and exact structures, not being so prescriptive in best practices. Some people just found this particularly surprising at first. Can you all talk about how this went in the work groups and how it came together?
That was definitely one thing. When I joined the work group, I was really expecting, well, there's no information on this. So let's come up with point A, B, C, like very specifics. Like, let's get a playbook for how you do this. As we all had these discussions, there were so many great practices and so many differences between our health systems that it was really hard to come up with more directive specifics, because what works really well for one organization may not meet the need or fit the structure or patient population or approach of a different organization. We were really challenged. And I think we did a good job as a work group taking a step back and then thinking about organization A does this, B does this, C does this. What's the underlying principle that those things stem from? And then let's make that the recommended best practice that people can then build off of.
2 of the early examples we spoke about, one is medication safety. So we didn't want to be prescriptive, say you have to have a medication subcommittee. Rather, it falls within the purview of P&T. Someone in the organization needs to oversee medication safety. It doesn't have to sit under P&T. If it's in your enterprise quality and safety group, that's okay as well. But there does need to be that link back. And that's a good example of where one really had to take into account the fact that these integrated delivery networks are structured so differently. You really need to think about that before you mandate these principles and have this checklist that one's forced to go through. You have to have some flexibility.
That's such a good point. And another example is even just the scope of oversight for P&T. A lot of organizations, including my own, we now try to have oversight of the medications in the clinic and infusion centers, whereas others may not have the resources for that. While the goal is to make sure P&T has oversight of everywhere medications are used, and that's described a little bit in the paper, not every place is resourced for that. And so we have to be cognizant of those differences as well.
Yeah, and I think that also goes to another point about thinking about the evolution of your P&T committee. The organization I was at started in 2015, and where it is in 2025 is quite different. It's not that one has to achieve all these guiding principles on day one. It's a roadmap. One can expect things to evolve. When we started, you may not have a specialty pharmacy, or you may not have certain clinics. And as you start to add those components, you start to need to think about, well, wherever medication. So the principle that we agreed on was if a medication is used within the system, P&T needs to have oversight. What exactly those particular elements of the clinics can vary within a system, and it can also vary over time. You also have to be looking at changes and evolving over time as the organization evolves.
So speaking of roadmaps and future states and forward-looking statements, how can our listeners and our readers use this panel's best practices?
One of the first things one can do is use this as an initial evaluation. Look at the guiding principles. Where is one at? Do that initial gap analysis. Are there any quick wins one can do? For example, adding that finance person to your P&T committees. Are there things that one can do more quickly? And that's the initial place to start is with that gap analysis. And then knowing what those gaps are, draw out a strategic plan for the next couple of years. Everyone often is resource constrained. One can't do everything on day one. Maybe there's some evolution that needs to happen with some shifts from your local to your central P&T. Starting to think about, do you need to move your resources around a little bit and get some help from this as you start to make some structural changes? So I think it's a really good starting place for anyone who's thinking of putting together an enterprise P&T committee, but even any site that already has one in place. It's a good point to start to do an evaluation and then assess where one needs to go in the future.
I could not have said that better myself. Totally agree with Prabashni. It's also going to be a really great resource for organizations that are about to or have just undergone a merger or acquisition or restructure and need some sort of guidance or suggestion for how to structure something. And then you could use this report as something to bring to their senior leaders or C-suite as evidence for the compelling why and the need to do this, because it is considered now a best practice in most of our organizations.
Using with the tool to communicate with the C-suite, the senior leadership in the organization who's not well versed in many of these details, the way it's written, the way it's presented. And I think the fact that it's really around guiding principles as opposed to sort of mandates really makes it very, very user-friendly as a communication tool.
Well, thank you both so much for both joining the panel, for your time and expertise, as well as joining us today on our Verified RX podcast.
Very welcome. Thank you for inviting us to be part of this.
Subscribe today. Like us. Send us your comments. We'd love to hear from you. Verified RX is a prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. Thanks for listening.